In this video, we're going to talk about abnormal bleeding. I know this can be scary, but I want to give you some peace of mind. Let's get into it. I pretty much see abnormal bleeding every single week in clinic. The way that I manage and take care of my patients depends on if the patient is in their reproductive years or non-reproductive years. So let's start off in reproductive years, specifically in adolescence. The most common things that I see in my teenage patients would be some sort of blood disorder. The most common reason for abnormal bleeding in adolescence or the teenager is that the communication between the brain, ovary, and the uterus are not mature yet. We call that an immature HPO axis. With those patients, it's important for them to keep a menstrual journal or a period diary. They can use an app just to see how their period is from month to month. We evaluate once the patient is about 16 years old and see if any additional investigation needs to be done. If we move out of adolescence and into the later reproductive years, we're thinking of things such as polyps, fibroids, possible PCOS, and we also don't want to exclude things such as infection and pregnancy, the obvious things. Also within this category include bleeding disorders in the reproductive years. Then when we move out of the reproductive years, meaning postmenopausal patients or that perimenopause range, I want to rule out the big scary things such as cervical cancer. They could also have benign things such as polyps, fibroids. Other big scary things would include endometrial cancer too. Bleeding in a postmenopausal person is not normal and needs to be evaluated. When I'm diagnosing the cause of abnormal bleeding, I start off with the patient history. I want to know how the period is abnormal, the frequency, the amount of bleeding. Then the next thing I do is a physical exam. So I do an internal pelvic exam to see if I can feel any obvious masses such as fibroids. And then I move on to blood work. The blood work may consist of a PCOS workup. I'm also checking your thyroid and other tests to see if there are other causes of this bleeding other than PCOS and thyroid. The next thing I'll do, if necessary, is getting an imaging study. And the gold standard for OBGYN is a transvaginal ultrasound. If that's not tolerated, a transabdominal ultrasound. So either an ultrasound inside the vagina or on top of the abdomen. Abnormal bleeding can affect your quality of life. So if that's something that you're experiencing, I want you to go and see your OBGYN and have this discussion. That way they can do a workup with blood work and possible imaging to help you get to the diagnosis or the root of the problem. I see abnormal uterine bleeding in my office every day, every week, so please don't freak out. Come to the office. We'll be happy to see you. If you want to hear more about topics like this, make sure to subscribe to my channel.